This week on WestfordCAT News, we update you on the Groton Road house fire, face masks are becoming more noticeable, and we speak with an infectious disease physician about COVID-19.
We'll have to see going forward. One is, are these vaccine candidates safe, and do they generate the immune response you're looking for?
Stay tuned. WestfordCAT News is next. The Board of Health on April 27th voted unanimously to close the town's skate park, leave the Freeman Rail Trail open, and delay opening tennis courts for 2 weeks as the shadow of COVID-19 hovers over the globe. That vote was sandwiched between discussions on whether to make face masks mandatory inside buildings. Here's Chair Zach Cataldo.
Masks are obviously very effective as you get into more densely populated areas. And in town, even though we're not a densely populated town, there are places like supermarkets and restaurants where people are going to come into much closer contact with each other, where they have to go through doorways and go through aisles. So I totally see your point, and I do agree that they are very effective. I think maybe a good first step would be to limit this to certain high density places in town, like grocery stores, restaurants, and big businesses.
The board members ultimately delayed voting on whether to make face masks mandatory when grocery shopping or entering densely populated buildings.
I think to the point that we issued a directive 2 weeks ago that was non-mandatory, I have heard from many residents who said they didn't hear about that. And I know we've done the best we can to get that word out. It was in the town manager's newsletter. It's been on Facebook and so forth. I think we might want to focus on just trying to think of ways to get that message out more. I don't know whether it's signage, whether it's staff telling, restaurants and grocery stores, they have to put up their own signs. I don't know. But I mean, that could be a way of achieving the goal, which is that I think we all agree that, that is a great tool to have, and that there's circumstances where you should be wearing a mask. It's just, I think where we're having trouble here is when we go to a mandatory order, there's a whole lot of implications there that we haven't quite figured out yet.
Stay tuned to WestfordCAT for updates. The Board of Health will take up the topic again at their next meeting. In other health department-related news, public health nurse Gayle Johnson recently addressed the issue of being tested for COVID-19 and how a negative test result is not a bill of health. Here she is with WestfordCAT.
If you were in contact with somebody who was positive, and I tell you, well, you know what, you were exposed, let's put you in quarantine for 14 days. And they said, well, I just want to get tested and find out. Okay, if that's what you choose. So let's say day 5 in that quarantine period, you get tested and you're negative. The viral load at that time may have been negative. You may not have it at that time. That, however, does not mean that you do not develop symptoms day 12, day 13, or 14.
To watch the entire interview with Johnson, visit westfordcat.org. On April 29th, the WestfordCAT News Director, Joyce Polino Crane, spoke with Emerson Hospital consultant Dr. Scott Paparella, an infectious disease physician employed by Acton Medical Associates. Here he is discussing the hope for a vaccine in the near future and the potential usefulness of antibodies in fighting off the virus.
Viral vaccines can be anywhere from fairly effective, such as the influenza vaccine. It's not perfectly effective, but it does minimize and prevent the disease in many people, or infections such as measles, where a vaccine is highly effective. Mm-hmm. So we'll have to see going forward. One is, are these vaccine candidates safe, and do they generate the immune response you're looking for? And then the bigger question is, are they protective against the actual infection? And those studies are going to be difficult, especially if the epidemic dies down and there aren't a lot of cases around.
To watch the entire interview with Dr. Paparella, visit westfordcat.org. In January 2018, the Board of Health condemned a house at 472 Groton Road after receiving complaints from tenants that there was no running water and 2 units had no heat. That house burned on April 19th. The fire caused substantial damage. Here's Ray Dick, the Director of Environmental Services, off camera, updating the board.
Okay, so the nit and gritty is our house out at 472 Groton Road caught fire last weekend. The underlining reason for that is still under investigation. So we've been working with the state police, fire and explosion investigative offices. We're dealing with the courts right now and town council. The receiver has boarded the entire building from the roof to the basement, and it has been secured. They are holding the key to the building. So that's pretty much the meat and potatoes of it.
Wow.
We've been dealing with the owner and his insurance company and yada yada, but I just wanted to give you an update on that, and we're working with town council for future steps on what we're going to do.
Oh my God.
And so, just to be clear, so the building is still under receivership, and what are the plans going forward?
So the building is still under receivership. I believe we've been working very closely with the receiver. As far as steps moving forward, we're at the stage right now where we have to decide if we want to deal with Mr. DiDonato's insurance company and drop the receivership, if we want to file that in court, or if we want to continue with the receiver moving forward. We're working closely with the building inspector to see if he would like to put together a demolition order for the building. We want to make sure the building's not going to sit there for years.
Here's Westford Health Director Jeff Stevens explaining what the role of a receiver is.
A receiver is a disinterested third party that is appointed by the court system that they have vetted out, that they have deemed worthy of taking on a building that needs code repairs. The reason why a receiver is used is the owner of the property has demonstrated that they don't have the ability to make those repairs themselves. Therefore, somebody with the wherewithal to make those code violation repairs to put a house back into sanitary code compliance is brought in. They have to come up with a budget. They need to come up with an entire work plan. And these are things that the town isn't required to vet out by the receiver. This is something that the court does. When we found out the receiver was not properly insured for this, that's a very frustrating issue.
Stay tuned. WestfordCAT will bring you updates as the story develops. If you'd like to watch the entire Board of Health meeting, visit westfordcat.org. I'm Patty Stalker, and you're watching WestfordCAT News.